last one, I promise. Hey everyone, my name's Brandon. This is my beautiful wife, Christy. And today we will be doing an assessment of the head, eyes, ears, nose, throat, and the neck. With that being said, I'm just going to move right into it. So the first thing when I'm doing this assessment that I'm going to look at is just kind of take a general survey of the appearance of her face and head here and neck. I'm going to be looking at the skin. I'm going to be looking for any obvious signs of systemic diseases like periorbital edema, any masses, things of that nature. I'm going to have the patient turn their head to the left and the right. So if you do that for me slowly. I'm just looking to make sure she doesn't have any facial hair. I'm also, I'm kind of looking at the skin. We always look at the skin when we do assessments. The other way, looking at the skin on this side, don't see any masses or anything that just jumps right out at me. I'm going to be talking to the patient. While I'm talking to the patient, I'm going to be observing her mouth and make sure that her mouth is moving symmetrically. Can you tell me your name, please?
Christy.
I can see her mouth is moving symmetrically. I'm going to have her smile, give me a big old smile. I can see it's symmetrical there. It's cranial nerve 7. I don't see any drooping or anything like that. So from there, I'll move into her scalp. Now, first off, I can see that her hair looks thick and it's well distributed on her head. I don't see any obvious patches or anything. So I'm just going to go up here. I'm going to kind of part her hair. I'm just looking to see if there's any scaliness or masses, lesions, anything like that. Just kind of moving through. I don't see anything. I'm going to palpate while I'm here. From the back to the front, looking for tenderness or masses, anything like that. Don't feel anything. No pain when I did that. Messed your hair up a little bit there. So from there, I would move right down to her eyes. When I move to her eyes, same thing. I would just kind of take like a general overview, make sure that there's no masses or discoloration or anything obvious that jumps out at me. They're symmetrical and kind of everything appears normal when I first look at it. I would look at her eyebrows. I can see that they're symmetrical and they're thick, evenly distributed. From there, I would move down. Kind of looking at her eyelashes are well distributed. They're thick as well. I don't see any swelling or edema on that upper eyelid there. I would move into looking at the external structures of the eye. So I'm looking right now. I can see that her pupils are equal and normal. I can see that the sclera is white. Her iris is round and looks normal. From there, I would move into, I would actually pull down here. I'm going to look at her lacrimal ducts, and at the same time, I'm looking at her conjunctiva and make sure there's no discoloration. So I'm going to pull that down here. While she's looking up, I can see it's no discoloration there. And her lacrimal ducts look patent, no swelling. All right, so from there, I'm actually going to check cranial nerve 2 and 3. Her pupil reaction to light here. I'm going to be looking for a direct response in this right eye and a consensual response in her left eye. So just look straight towards me. All right, and I did see a direct response in that right eye and a consensual response in that left eye. I'm actually going to hold on to this. I'm going to use a soft piece of tissue here. Wisp of cotton would be something else you could use, but I'm just going to test cranial nerve 5 and 7. It's going to be her corneal reflex. I'm just going to take this and just kind of get right up to that cornea, and she blinks. So that was a good check on that. All right, so from the eyes, I'm going to jump over here to her ears, actually. And, I can see her ears. They're symmetrical on both sides. Well, I did forget to add, I'm sorry. I need to do accommodation will be the last thing for the eyes. So if you can look at my finger right here, I'm going to go straight towards you. And she did have accommodation there, so that means that she will be perla. So now moving back onto the ears, I'm going to look at both sides. I can see that they're equal. I don't notice anything. I'm looking at the skin too. Skin looks normal. I'm actually going to palpate first with the pinna. I'm going to move that. I'm looking for pain here, tenderness. I can feel her ears, her pinna is firm too. Any pain there? Tragus, I'm going to press on that. It's firm, no pain. And mastoid process back here, no pain on that. All right. Then with her ear, I'm just going to look at her external auditory meatus here. I'm going to pull the pinna up and back. Look in there. I'm just looking for any drainage or anything like that. All right, don't see anything there. All right, from there, I'm going to move into her nose. And I look at her nose, and I can see that it looks symmetrical on both sides. I'm looking at the skin condition. Her septum looks like it's straight here. I'm going to check for patency on both sides. Can you cover up one nostril and breathe for me? All right, and the other side. All right, looks patent. I'm going to use my light here again. I'm going to have her tilt her head back. And when I'm looking at her septum here, and I'm going to look at her turbinates. And I can see her septum looks smooth and pink. And I'm looking back at the turbinates. I can see they're red. Barely see them, but I don't see any drainage or anything. All right. Last thing for the nose, I check her frontal and her maxillary sinuses. So for her frontal sinuses, they're up here. So the orbital ridge, I'm just going to kind of gently press up, just feeling for pain. Any pain, discomfort? No? All right, then the maxillary sinuses, I'm going that zygomatic arch there, and same thing, I'm just going to kind of press up. Looking for discomfort or pain? None? All right. So for there, I'm going to move down into her mouth, just like with all the other systems. I'm going to start with just a general survey of it first. I can see her mouth looks symmetrical. Her lips are pink. The texture is appropriate. I'm going to look at the vermilion border. I don't see any bumps or lesions or anything like that. So I'm going to grab my tongue blade. First, I'm going to start by pulling down her lips. So I'm going to pull down her bottom lip first. I'm just looking at the texture. I'm looking for any swelling, discoloration, anything like that. I can see it's pink and moist. Looking at her gums, they look healthy and pink, moist. I'm going to do the same thing with her upper lip. Pull it back, looking at texture, pink and moist. Gums look healthy. Now I'm going to use my tongue blade and I'm going to pull back her cheek. I'm looking at the oral mucosa and her teeth and her gums as well. On this side, actually I'm going to use my light too, it'll be a little easier to see here. I'm just going to pull it back here. Oral mucosa is pink. I don't see any edema, any discoloration, bumps. Gums look healthy. Same thing on the other side. Oral mucosa is pink, looks good. All right. Next thing I'm going to do, have you stick your tongue out for me. I'm just looking at the texture of her tongue here, and the color is pink. It's an appropriate texture. Have you stick your tongue to the roof of your mouth. Frenulum is midline. Also, I'm looking at her Wharton's ducts. They appear patent. They're not swollen or anything like that, so that's good. Next thing, I want you to open up your mouth. I'm going to look at her pharynx now. So the first thing I'm going to look at is her hard and soft palate. I can see the hard palate's white, soft palate's pink. I don't see any bumps or lesions where they join. Say ah.
Ah.
When she said ah, your uvula raised and stayed midline. That's cranial nerve 10 right there. I can see her tonsils. They're +1. No exudate or anything, and no postnasal drip that I can see. Let me get rid of this tongue blade and this light. All right, and finally I'm going to move into the neck and the throat. First thing, just like we did with the mouth and everything else, some just general survey. Looking at the skin looks good. I don't see any masses or scars, nothing like that. I'm going to check her range of motion. Can you turn your head side to side for me? Can you push your left ear to your left shoulder and the other side? And then chin to chest, and then hyperextend. Right, so that looks good. And come back. And when she was doing that, I was looking. Her trachea is midline. I don't see any deviation in that, so that's good. From there, I'm gonna before I do her thyroid, I'm gonna do her lymph nodes. So we'll start with the preauricular right up here, and I'm using the pads of my fingers. And I'm just gonna try to palpate here. Those are non-palpable, which is fine. And go to the postauricular back here on the mastoid process, which are non-palpable. The occipital back here, base of the skull, non-palpable. I'm going to move right down here, right off her ears here, down here on this, right by her mandible right here. Palpate. Can actually palpate those. They're tender and mobile. Submandibular here. I can palpate those as well. They're soft and mobile. Palpate this one, soft and mobile. Next, going to the anterior cervical, straight down here on our sternocleidomastoid. Those are non-palpable. Posterior cervical, which is going to be on the anterior ridge of our trapezius muscles here. Feel those a little bit. Feel soft and mobile. And the supraclavicular is where her sternocleidomastoid meets her clavicle. I feel right there. All right. I was talking about earlier, her trachea was midline, so I can see her thyroid and cricoid cartilage. I'm going to have her swallow. Can you swallow for me? I see symmetrical upward movement there of her isthmus, and I'm going to go around behind her to check her thyroid. I'm going to put my thumbs at the base of her neck. I'm going to find that cricoid cartilage again and kind of go down just underneath that. Swallow for me. I can feel that isthmus rise up into the pads of my fingers. Next, I'm going to gently palpate the thyroid. I'm going to take this right hand and gently deviate that trachea to the left so I can palpate. I can feel it. No masses or nodules on that. And I'm going to repeat the same for the other side. Soft, no hard nodules or anything like that. All right. And that concludes my assessment of the head, eyes, ears, nose, throat, and neck.